Thank you.
I want to thank you, Mark and Nicole and Matt and, of course, Shane for putting on such a wonderful program. And Shane really couldn't have said it better in his video in this dream we have at New Objective for what we believe is the future of mass spectrometry, of the column being the source. And my title maybe there is a little presumptuous, and that ultimately the source is the patient. And really, the theme, of course, here has been the patient at CPSA. We need fidelity in our analysis from the patient through to the analytical result. If a physician's going to make an informed decision, they need to know that the data is good. So if we look at the existing and future needs for clinical mass spectrometry, we can go back to Fred McLafferty's 4 S's. We need speed, sensitivity, selectivity, and the 4th S being the $sign. We need low cost. So what was true 30 years ago in mass spectrometry is true today. We need more of it, right? But we also need robustness. We need ease of use. Now, we're a nanospray company. Those last 2 things aren't necessarily topics that you would associate with nanospray, but that's what we're striving for at New Objective. And so we ask this question, what is your spray DNA? We have 4 very important characteristics: emitter size and shape. That's very important to maintain good stability in your spray, which ultimately translates to low noise and the best possible signal quality and lowest relative standard deviation when you talk about quantitating peak areas, right? You want a stable spray through that elution from the column. Position, you want to maintain good collection efficiency and good reproducibility. Of course, voltage, we're all familiar with voltage, whether you do nanospray or conventional electrospray. The setting of the voltage is very important for spray stability and ultimately, of course, going back to maintaining a good low RSD. Flow rate, stability, efficiency, speed. So we need to control all of these if we're going to use electrospray as the ionization mechanism in clinical mass spectrometry. So we believe that one answer, one path to obtain this is through integration. So we want to integrate the flow path from sample prep through separation and ionization. So as Shane says, and he said in that video, and if he talked about, I know he talked about that at our user meeting, at lunch, as well as in the innovation session, that the column is the source. So we've got 2 platforms at New Objective for developing this theme. One is the PicoFuse system, which Shane talked about. That's an integration of our best-in-class PicoFrit technology into conventional AB electrospray ionization source. And the second is the PicoChip nanospray system, which is, again, best-in-class PicoFrit separation performance combined with an extremely easy-to-use platform, which is also very low cost. So I encourage you to come to our exhibit booth this afternoon and learn more about these wonderful new products from New Objective. Thank you.
Thank you, Gary.